employees portion of the health benefits marketplace, brought to you by the League of California Cities. A couple of housekeeping items real quick before we get started. All attendees are in listen-only mode, and if you'd like to ask a question, you can go ahead and do that. As you can see the picture to the right-hand side of the screen here, and type those into the questions box. All questions will be addressed at the end of the presentation, and if your question is not addressed, we will address it separately to you. So with that, I'd like to introduce Chris McKenzie. Chris?
Thanks so much. Hi, everybody. This is Chris McKenzie, Executive Director of the League. We're very pleased to be with you today. Joining me will be Barry Eyre, who's the consultant who's worked with the League now over a year in developing the marketplace. Pat Kelly, from whom you heard just a minute ago from Connexure, and Amy Christophis from Connexure as well. The health benefits marketplace really is a powerful technology solution that makes the delivery of health benefits easier and more cost-effective for you and your entire workforce. It's the result of over 18 months of work during which the League evaluated options for solving the challenges that you're facing in providing insurance for your active employees and your retirees. And in doing so, we ran a very highly competitive request for proposal process before we selected our partners for this venture. Connexure was chosen as the partner to run the active employee solution, which offers medical, ancillary, and voluntary benefits options. Willis Towers Watson was chosen as the partner for the pre-65 and Medicare-eligible retiree solution. Accord was chosen as the partner for the Affordable Care Act Compliance and Reporting Program. And Wellwright was chosen as our partner for the employee wellness programs. We're very pleased to offer an active employee solution to provide cities with efficiency through a flexible platform where they can offer their employees more choice and help manage overall health care costs.
Thanks, Chris. This is Pat Kelly with Connexure, and just to quickly walk through our agenda today, we'll walk through an overview of what the health benefits marketplace is for active employees, talk about carriers and products that are available, walk through a demonstration of the shopping platform, talk about an overview of the benefits administration platform, and then walk you through the implementation and timeline for the active benefits. And with that, I'll hand this over to Barry Eyre to talk a little bit about the challenges that cities are facing today.
Thanks, Pat, and good morning, everybody. There are various challenges that are being faced by public agencies in California currently, and the League is very aware of these because of the communication from the members to the League. And so the platform has been put together to really try to help address as many of these issues that you're facing as possible. Primary was ballooning OPEB liabilities, and that is going to be covered in a webinar that we'll be having tomorrow on the retiree solution. Additionally, it was obvious that we're facing issues related to both active employees and retirees. So the health benefits marketplace has been structured to cover all the constituencies that you provide benefits to. Additionally, Affordable Care Act reporting is an area which placed burdens on human resource departments, very technical, cumbersome requirements. So creating a platform that can help with that process was definitely something that was important. Clearly, flexibility and local control are, significant factors that were highlighted by members, particularly those that are members with CalPERS. But in general, the ability to manage, an array of benefit plans is something that, in a streamlined and manageable process, was paramount as well. And so the platform and solution that we've come up with is something which helps to deliver your benefits flexibly. And obviously, healthcare costs in general are a very important issue. the various different programs that come together as part of the health benefits marketplace are designed to help leverage technology to bend the cost curve related to providing health care benefits. And we also look forward to integrating further developments in from technology to help manage these costs going forward. So with that, I'm just going to pass it back to Pat, and he's going to get into how the platform actually works.
Thanks so much, Barry. So we're going to talk a little bit about an overview of how this works and just a general sense of how all of this comes together under the technology platform that we've put in place for the health benefits marketplace. So as a general concept, the health benefits marketplace is built to use technology to drive efficiencies and produce savings. This is done in a number of ways that you can see here. Network and carrier efficiencies, built-in wellness programs, consumer-driven plans and healthcare consumerism, helping with administrative efficiencies of general day-to-day management of employee benefits, and then finally the Affordable Care Act reporting, tracking, filing process that is required of large employers starting this year and on into the future. So the health benefits marketplace is broken out into two pieces, and when we think about how this is set up, there are employees who will have access to not only gain enrollment to their health insurance, ancillary programs, voluntary programs, wellness, and other types of programs that might be available to them, but they're going to be able to review, compare options, choose those benefits that are best suited for them, really personalize their benefits portfolio, and they're also going to have access to tools like our recommendation engine, which we'll walk through a little bit further later in this presentation. The other side of the health benefits marketplace is the administrative benefits administration platform. So this is going to give us not only a robust capability in terms of managing new hires, life changes for employees, benefit corrections, helping us manage evidence of insurability for different voluntary products such as voluntary life insurance and other types of products like that. It's also going to help us manage the electronic data that's going to be dispersed to all the carriers that are going to be online with your city's benefits. So in terms of that process, we'll walk through a little bit of it later on. And then a comprehensive reporting package that is baked into the platform, as well as additional analytics that would be available to help you not only continue to strategize around your employee benefits, but structure your benefits strategy in a way that is going to fit the needs of you and your employees. So after our initial webinar, we found through our survey that 80% of cities were looking to have ACA compliance as a solution, as it's a very large concern for them. To address these needs, we've partnered with Accord Systems, and Accord Systems is integrated with the benefits platform. So we're able to aggregate all the employee benefits data, and we can also help generate the 1094, 1095B, and C forms. Employer forms are ready and to file, and optional filing services are also available. And employee forms are also generated in a batch format, and an XML file is sent to the IRS from the system. So employee forms are also sent to the employer for distribution. So the city has the ability to easily access this data, easily distribute the required forms to employees, and file with the IRS. If you'd like some more information about that, we will not only have some additional webinars that we'll talk about later at the end here, but you can go to www.cacities.org/HBM and click on Contact Us. The other additional service that we discussed briefly was the employee wellness. We've partnered with a company called WellRight and have integrated it with the health benefits marketplace. And WellRight provides not only biometrics, health coaching, health assessments, but cities are able to customize a wellness program that truly gives a holistic approach to not only fitness, nutrition, mental well-being, and financial, but they can also, employees can also integrate with their wearable technologies like Fitbit, Jawbone, MapMyFitness. And then it's an overall educational platform to help participants understand how to not only select the challenges and take advantage of the program, we can also support rewards and incentives to help increase participation within that program. So again, if you'd like some additional information about this, you can go to www.cacities.org/HBM. So let's talk a little bit about the overall benefits of the health benefits marketplace. So technology is the key driver, as we had talked about earlier in that ecosystem, to help us increase efficiency, reduce errors, help us increase additional efficiencies with file feeds to the carriers, so taking paper out of the process, supporting the aggregation of benefits data for ACA reporting, and really creating an easy online shopping experience for your employees excuse me, to enroll online. So not only that, but we support a range of benefits options, excuse me, including high deductible health plans, ancillary, and voluntary options. We have the flexibility to support fully insured and self-funded programs, as well as when your employees are going through the online shopping experience, they're going to receive personalized recommendations, which helps empower the concept of healthcare consumerism. Guidance through the process is going to be very easy. It's a very retail-like shopping experience. The platform is going to be branded to the city as well as communications with employees. And as we talked about, wellness and Affordable Care Act compliance is integrated within the platform. In terms of some sample results that we have seen after implementing the Shopping and Benefits Administration platform, we've seen cost savings in administrative efficiencies where HR is able to save time, and that would equal a $10 per employee per month savings, totaling $120 in total annual savings per employee just in administrative costs as far as the efficiencies around online enrollment and getting out of a paper process. We've seen upwards and beyond of 125 hours in real-time savings. And we've also seen employees save 13% on their premiums, enrolling in less expensive plans, personalizing those plans based on their actual needs for health care. And it's a very easy enrollment process. So the vast majority of our clients complete open enrollment earlier than typically with a paper process. And one of the great compliance benefits of this platform is you will be able to achieve 100% enrollment of the eligible population year one on the platform. So let's talk about a couple of scenarios that many of you may be looking at today. Scenario number one, keeping your current benefits, adding wellness and ACA tracking. Utilizing the health benefits marketplace for employees to choose and enroll in plans is an incredibly efficient process when we look at how the employees are going to be able to make better decisions around the plans they're choosing, educate themselves, as well as offering the integrated wellness program and ACA reporting. So taking advantage of putting everything online, the decision support technology with your current benefits and current plans is an easy step step one into utilizing the benefits marketplace. Scenario number 2 is expanding choice. So not only can we give employees more choice in terms of if you're looking to add additional health plan options, but we can also help with additional options with ancillary benefits, employer-sponsored ancillary benefits, as well as voluntary benefits, adding PPO, HMO, high deductible plans, and we have an integrated spending account solution for HSAs and HRAs, HSAs being health savings accounts, HRAs being health reimbursement arrangements. And this helps increase adoption of all of the additional choice when it comes to the additional plans that you're able to offer. And it's not going to increase the administrative burden of expanding choice because all of it is going to be managed online. Scenario number 3, increasing consumerism. Healthcare consumerism has been talked about at length for many, many years now, easily the last 10 years and beyond. So introducing high deductible health plans may not necessarily be a new concept to you, but it may be a new concept to your employees. And when your employees are looking at enrolling and helping them understand these new options and pairing them with the tax advantage savings of accounts like health savings accounts, HSAs, introducing the concept of healthcare consumerism can help employees and you better manage costs through changes in behavior. For instance, if an employee is going to enroll in an HSA qualified plan, that will change the typical behavior that they will have when they go to access care, going to less emergency room visits, for instance, or utilizing telemedicine, those types of things, and because of those deductibles. And what we do and are able to accomplish via the online enrollment process is help educate them via videos, additional educational content, and things like that that we can actually embed within the shopping experience. So I'm going to go ahead and pass this back over to Barry, and he'll talk to us about the participating carriers that are currently working with us on the health benefits marketplace.
Thanks, Patrick. So we're going to advance the slide. So what we did when we looked at the types of carriers and the types of plans that we wanted to integrate onto the platform, and what I say when I mean integrate onto the platform, these carriers that have agreed to participate on the health benefits marketplace, we have created electronic data interface so that we can do electronic enrollment with the carriers. That's a critical component of making the administration process streamlined. We wanted to look at a range of plan offerings so that we could support the concept of consumerism that Patrick was referring to earlier. Obviously, this is not necessarily the first step that a lot of public agencies are going to take. Your employees are used to a certain level of benefits, and so as we looked at the types of plans that we wanted to build on the platform, we knew that it was really important to have a set of plans which were very, quite rich, really great coverage, and we have done that with all of these carriers. Additionally, though, it was important to layer on some optional choices with higher deductibles. And so for all of these carriers, we've included plan offerings which have a range of increasing deductibles as well. So what that allows you to do is to either choose a set of carriers and plans which are more closely aligned with what you likely have currently, or if you would like to offer additional plans alongside those current plans which provide higher deductibles, we have those pre-built onto the platform. Now, you see these carriers here. This is a footprint of the entire state. We thought it was very important to have Kaiser on the platform because of the prevalence of Kaiser in the marketplace. We also have some regional HMOs and PPOs which cover the entire state. However, if you have a carrier that you're currently working with that is not on this list and you are interested in taking advantage of the enrollment features and other ease of efficiency that we've been discussing, we can build other carriers onto the platform. It's a very efficient, very flexible platform. We can also customize plan designs as well. So if you see the plans that are available from a particular carrier here, and there's an additional plan that you would like added, we can build additional plans. What we're bringing to you is a menu of plans that would allow you to put in place a benefit offering that addresses the range of needs that you might be facing currently, but we have a great deal of additional flexibility to add carriers or other plans if that was something that you wanted to do. So in addition to medical plans, we have a range of ancillary and voluntary benefit offerings that are also built onto the platform. So this ranges from dental, vision, life insurance, supplemental health, and then also some other things that you may not currently offer, such as identity theft and pet insurance. So these plans can either be employer paid or completely voluntary or somewhere in between. So again, there's a range of plans, a great deal of flexibility, and we have the ability to integrate other carriers if there was a particular carrier that you wanted to utilize which was not already integrated onto the platform. In terms of the quoting process, similar process really than what you're currently looking at. We would work with your broker or consultant. Your broker or consultant would help to evaluate the plans which are currently built onto the health benefits marketplace in the large group setting. Again, as I mentioned, if there was a plan that you wanted to have integrated onto the platform that was not there, we would work to do that as well. So your current broker or consultant would transmit demographic claims and census information to the health benefits marketplace. We obtain quotes from the carriers that are built onto the platform or those that you would like to utilize that are not there. We push those quotes back to your broker consultant, help to review them, make decisions about how you would like to proceed, and if you decide you want to utilize the health benefits marketplace, we then start the implementation process. Small groups, community-rated plans, slightly different process. The only thing that's really different here is that your broker or consultant gets quotes directly from the carriers. You make the decision about which carriers or plans that you wanted to utilize, and then you let the health benefits marketplace know, and we build those plans onto the health benefits marketplace. Again, that implementation process takes approximately 3 months. So that's the overview of the quoting process. So I'm going to pass it over now to Amy for the demonstration of the shopping experience.
Thank you, Barry. Good afternoon, everyone. So I will be talking through what the employee-facing shopping platform looks like. A couple things I'd like to draw your attention to. First, you'll notice that this has the League of California Cities logo here. That can be customized for your particular city, and you'll make some other branding decisions there as well. Secondly, I'd like for you to note that we do have a shopping cart here. The shopping cart is going to look and function very much the same way that it would look on an Amazon.com or Zappos.com. Also, note that once logged in, the site will greet an employee by name. So I'll talk a little bit in further detail about the implementation process, but once somebody logs in, the site will recognize who they are, their basic demographic information, any dependents that they have, as well as what plans they're eligible for. So from here, somebody would go into the shopping portion. You'll see there's some language that helps describe what medical insurance is, how they would utilize it, and why they would want to purchase it. I'd also like to point out that we do have a cost calculator here that will update as we update our cart with some additional coverage. So once I start shopping, you'll see I have two options. I can either go directly to Get Plans, or I can move over to the Get Recommendation engine. So as we mentioned before, the site will ask folks a couple different questions that will help them determine what might be the best plan option for them and their family. This is going to be the first question, and it's really getting to the heart of what the employee's risk tolerance is. So do they prefer to pay more when they're at the doctor and when they need care, or do they prefer to pay more out of their premiums each month? It's important to note that regardless of how somebody answers those questions, the number of plans will not vary. It will just be reordered. From here, they're going to answer 5 questions about how they and any dependents that they're covering under the plan tend to utilize their health insurance. So how many times do you typically visit the doctor in a year? How many prescriptions do you typically fill? Do you seek care at the emergency room once or more per year? Do you typically stay overnight at the hospital? And do you have 1 or more outpatient visits per year? From there, the system will tell them what plan might be the best option from everything that their employer is offering them. So the plans would be ordered most appropriate from top to bottom. The second thing that the decision support function does is provide these 3 cost estimates. So based on how they answer those questions for themselves and their dependents, this is saying if they utilized absolutely no care throughout the course of the year, this would be their minimum cost on this plan, just given their payroll deductions on a biweekly basis, that amount annualized. Now, if they used health insurance pretty closely to how they responded to those 5 questions, that's calculating this amount directly with this plan, so based on the deductible, the coinsurance, any copays, etc., and also includes their annualized premium. If they had a bad claim year, they maxed out their plan and hit their out-of-pocket maximum, this maximum possible cost would represent that amount plus their annualized deductions. Just to point out, we do have some basic information about the plan here. Should somebody want to see more detailed description of how the plan works, they can use this drop-down, more information. We would also have the plan documents or SBCs posted out here, as well as the provider directory that they could reference. Once they have selected an option, you'll notice that the cart has been updated, and the system is now going to push them into the next available plans that they would need to make decisions for. For this particular employee, that's going to be their vision policies. You can see they've got a couple different options here, and again, it's going to give a brief summary of how the plan works. Should they want more information on either of those, they can go to the drop-down menu. Now, we'll talk a little bit about life insurance, both basic group-provided and voluntary plans for the employee, the spouse, and any children that they may be covering. If somebody was interested in purchasing voluntary life insurance, the system will recognize and understand any guarantee issue amounts that are built into the plan, as well as evidence of insurability rules. So you can see here this employee has the ability to purchase these 5 plans. The guarantee issue on these is $100,000. And so should they request anything above that, that amount would be pended. The system will then remind them that they have to complete the evidence of insurability form and have that submitted. So you can see here the pended amount is also showing up on this screen. As Pat covered, there is a pretty extensive amount of plans and policies, and as Barry noted, we can certainly customize this to what you have in place or what you would like to put in place for the next plan year. So all of this site is customizable. Once somebody has made their selections, put everything in their cart that they are interested in purchasing, they would go to a review page and would be prompted to review their benefits one more time. From this page, they're going to see a summary of everything that they currently have indicated they want to purchase. They'll have the ability to edit anything directly from here or put something into their trash can and remove it. Again, we have another reminder that they will want to designate their beneficiaries on any life insurance products, as well as complete the evidence of insurability. They will also be prompted to actively waive any coverages that they are not purchasing. And then they're going to have another calculator down here that just indicates what their total premiums would be. Once they hit submit enrollment, they will also have the ability to print out a confirmation page and save that for their records. And then once they hit finish, they will be signed out of the site. This information will all be available to them throughout the course of the year should they sign back in. Obviously, they would have to experience a qualified life change in order to make any changes to their coverage, but they can go back and review what they have enrolled in. Now, from here, I'm going to give an overview of the benefits administration system, exactly how that ties into the shopping platform and any other systems that you may have in place today. So the benefits administration, or BenAdmin for short, will handle a couple different systems of record. So you'll be able to manage employees from here, any new hires, life changes, correction events, etc. This system will be available to administrators within your company. So this could be any HR folks, anybody that would need this information for payroll purposes, etc. From the BenAdmin system, we also develop file feeds that will go directly to your carriers with enrollment data. We build these file feeds to the specifications of the carriers, and they will go over at a previously agreed upon date and time. This information will be sent throughout the course of the year and basically eliminates any paper process that you may have in place today. As I mentioned, this will also help manage the evidence of insurability process for any products where there's guarantee issue or beneficiaries. Additionally, we'll also have some reporting capabilities here that can be run at any point in time or can be set up to run automatically. Now we're going to take a look at a couple screenshots of the BenAdmin system. This is going to be what you would see upon first logging in. We have a dashboard here that would bring to your attention any items that may need your review or any products that may be pending underwriting decisions. This is an example of an employee record. So from here, we would be able to see what an employee is enrolled in today, what they've been enrolled in the past or possibly in the future, should we be in the middle of an open enrollment period. We would also have any rules built in about this particular employee, what benefits they may be eligible for. One of the things that we'll go through during the implementation process is understanding how you as the employer will think about your employees, any varying payroll groups that you may have, if you have different job classes, etc. All of that information will be captured here for each employee. We'll also be capturing any dependent data, and we do have a date and time stamp for anything that has happened on this employee's record. Additionally, this is an example of some of the reporting. As I mentioned, you do have the ability to set these up to be run. So if you needed a report on a weekly or biweekly basis, you could set it up to be ready for you in your inbox by the time you get to work on a Monday, for example. So that's basically a high-level overview of both the shopping platform and the BenAdmin system. I want to take just a few moments here and walk through the implementation timeline. As Barry indicated, it is about a 3-month timeline, about 90 days. During that time, we typically have weekly meetings with you and anybody on your team that would need to be involved. We'll do a deep dive into understanding your population, any benefits that you have in place, who your carriers are, what those benefits look like. We then go back, we build the system, we build both the BenAdmin and the shopping platform. We will go through mutual testing processes. We'll do some internal testing, hand it off to you to make sure that the site has the look and feel that you would expect. And during that period of time, we're also building the file feed connections with the carriers. We do have some training set up to help walk you and your team through how the system will function, and then ongoing support throughout the course of the year. A couple things to note. So during that implementation process, you will not need any IT support or anybody from any technical resources. It's typically about 18 to 20 hours of the HR staff's time. The items that are needed for the implementation are just your basic plan documents, any rate and contribution information. We will, as I mentioned, do a deep dive of understanding how you think about your population, and then go through a testing phase and a training phase. And that basically sums up the implementation. So with that, I'm going to hand it back over to Pat.
Thanks, Amy. So going back to our question and answer process, on the right-hand side of the screen, you'll see a box that's labeled questions. You can go ahead and type those questions in, and our moderators will go ahead and read those off, and the right person who can answer that question, if it can be answered on this particular call, will go ahead and do that. So if our moderators could want to give us our first question, we can address that now.
Okay, we have a couple of questions coming in, and if you do have questions, be sure to type them into the question box so that we can see those and answer them. The first question is, how does this work if we currently offer insurance using CalPERS offerings?
So this is Barry, and I will take that question. So there's two issues here. One is that oftentimes cities within PERS may not have a broker or a consultant, and as I described the quoting process, brokers and consultants are a part of the process. So we have discussed various different solutions about how to address this issue, including the idea of utilizing your colleagues within the league that have current brokers or consultants to make referrals to member cities to help them find a broker or consultant. Another issue that kind of is part and parcel of the dealing with PERS is the fact that a lot of the carriers that are part of the health benefits marketplace are currently within PERS, and there are restrictions in terms of these carriers being able to make quotes for cities that are contemplating leaving PERS before they have given irrevocable notice that they are going to be leaving the system. So, one of the things I did describe is the fact that the carriers that we have, that I showed the list of, there are ones that are implemented on the system currently. There are other, obviously, carriers in the marketplace that are interested in quoting for cities that would like to be on the health benefits marketplace that are not necessarily fully integrated into the health benefits marketplace. So we have other options in terms of obtaining quotes for cities that are contemplating coming out amongst other carriers that are not part of PERS. And given the timeline, we would be able to get quotes so that you could evaluate, make a decision whether or not you wanted to come out of PERS, and then potentially still get a quote from a city inside, a carrier inside of PERS after you'd given that notice to give you a level of comfort. So that is kind of the evolving model of how we're going to help cities that are currently within PERS evaluate whether or not they would like to participate in the health benefits marketplace.
Okay, and here's a question regarding the rates. Are rates based on an individual agency's health experience information, or is there a flat rate for all participating agencies? Is there a discount rate benefit for enrolling in the health benefit marketplace for the agency?
So it's a great question. For large groups, it is individual underwriting according to your experience. For small groups, it's community rated plans, so there are single rates. The question about a discount is an interesting one. We have had discussions. Obviously, the administrative efficiencies that are accrued to cities from using the platform for enrollment also accrue to carriers. So the carriers that integrate with the health benefits marketplace will certainly have cost savings. And so there are discussions now about how that will impact rates. But we can't say definitively that there will be a discount in terms of the rates, but certainly there are many other administrative efficiencies and other cost savings that will accrue to cities from utilizing the platform. But that is an ongoing discussion that we're having with carriers, and we will see as we start to get quotes as well. This is not going to be a pool, though. I think that is kind of at the heart of the question here. Are we pooling all the cities together and utilizing a pooled structure to leverage rates? because the pool has not yet been formed, the carriers were not prepared to give us pooled rates, so we are, at least initially, doing individual underwriting.
Along those same lines, the question is, what about CalPERS agencies who have no experience to offer for a quote?
So, another good question. Carriers will make quotes to cities with no experience. We'll just have to evaluate those quotes relative to what you currently have through CalPERS and see whether or not they're aggressive enough to make it a comfortable choice for you to make to come out of CalPERS. So it's not that insurance companies won't quote. They may not be as aggressive with their pricing as if they do have the experience, but carriers will quote without experience.
Barry, do you also want to talk about what the carrier's policy is for those agencies that move out of CalPERS for the first year?
Yeah, so some of the carriers within CalPERS, if you decide to leave CalPERS and you then end up, staying with a carrier, you've given your irreconcilable notice to leave, but you end up still working with a carrier that is part of PERS, they hold the rates the same as if you had still been in PERS. Now, there could be differences in plan design, but they have ways to make adjustments for that relative to the standard PERS rates. But that is a policy of some of the carriers within PERS, that they will maintain the rates as though you had stayed in PERS for the first year after you have left. So it's kind of a convoluted system, but that is the way some of the carriers are handling it.
Okay. We've had a number of questions regarding the fees. What are the fees for participating in the marketplace platform?
So there are PMPM charges for participating in the platform that are on a sliding scale according to the size of your population. So anybody who is interested in getting specific information about their cities, I encourage you to contact us after the webinar, and we can help to determine exactly what those charges would be, because they're going to be different for everybody, basically.
Okay, and how will this coordinate with self-funded claim administrations?
Patrick, do you want to take that one?
Sure thing. So in terms of the claims administration itself, this platform is going to be specific to the enrollment and eligibility. Now, we do have the opportunity to utilize and enhance some of the additional tools that are available, including potentially having some disease management programs included within the platform. And so there's a lot of flexibility for the opportunity for a self-funded plan to utilize the platform. But for the most part, the main purpose is going to be the actual enrollment and management of eligibility throughout the plan year. And then we can also utilize it as a communications platform and an engagement platform. So what we can do is, if you have specific questions or if you'd like some more information about that, I would encourage you to contact us, and we can set up some additional time to speak with you individually about your specific agency needs.
Okay, we've had a lot of great questions, and here's another one. Please address pre-tax and post-tax issues for those agencies with IRS Section 125 programs. Can you accommodate them?
I can take that one as well. Yes, absolutely. The pre and post-tax payroll deductions are going to be accommodated. We do have the opportunity and, again, flexibility to not only integrate with your payroll system, but if you have a current HRIS platform that you're utilizing or anything that is going to be specifically dealing with payroll deductions, we can integrate with those, and you will have the ability to identify what is pre- and post-tax contributions for those specific products, such as life insurance and other voluntary products that are going to be deemed post-tax. versus pre-tax medical contributions.
Okay. Can you purchase voluntary coverages without participating in the medical coverages?
Absolutely.
Go ahead,
Go ahead, Barry.
Yes, so we've had this question from a number of cities, and we can structure the platform so it works that way. So this is another point in general. I did mention that we're going to have a retiree webinar tomorrow, but there is, and many cities obviously are providing benefits to both active employees and retirees, but there is no requirement to utilize the platform for both your actives and your retirees. You can separate those, you can separate the funding levels, and also we have flexibility in terms of the types of benefits that are delivered. So it's along the same lines as this particular question about separating medical benefits from voluntary benefits. But again, what we're trying to do is offer a very flexible platform to address whatever your needs might be. So, you know, you tell us what your problems are, and there's a good chance that we're going to be able to address them because the platform is so flexible. So yes is the answer to the question.
Okay, we have two questions that are similar, but they have different time horizons. So the first question is, how does timing work if we were to enroll now with open enrollment in October? And along those same lines, but with a longer time horizon, so with a 90-day implementation period required, the deadline to begin a new group enrollment that has a 12/1 effective date would be tomorrow, 9/1, correct?
So yeah, I can take that one, Norman. And for the question about the October 1st enrollment, I would like to have a separate conversation regarding that. So if you would kindly, we can reach out to you after this specifically to discuss that. There are different time frames based on the different types of vendors and carriers that you're currently utilizing or would like to utilize for the enrollment. So we do have a few different buckets of time frames that we can walk through. The 90-day is a very high-level general time frame that we utilize. There can be shorter time frames, and 90 days is typically the on the long end of that time frame. In terms of the 12/1, the December 1st effective date, it's going to be heavily dependent on when your open enrollment dates are scheduled, and again dependent on the carriers and vendors that you're utilizing and would like to utilize to deliver benefits. So we would like to absolutely have a conversation, but I would encourage you to us to have that conversation versus specifically telling you that the deadline is tomorrow.
Okay. What is the minimum number of employees in order to enroll in the health benefit marketplace? And along the same lines, a second part of the question is what is the minimum threshold to be considered a large employer?
There's no minimum number for members of the league. And so you become a large employer once you hit 101 employees. That's the threshold between small group and large group.
And just to clarify on that point, I'm sorry, Norman, just to clarify on that point, it's full-time eligible employees in terms of the count at 101.
Right, and just so that it's clear, that's not, we didn't make that number up. That is, you know, that's defined by insurance carriers in the law.
Okay. I know that tomorrow we have a webinar on the retiree, but a question did come in, and so maybe very briefly, Barry, you would like to touch on this one. The question is, how do you handle retirees that are eligible for health benefits?
Well, I'm not sure. There's some ambiguity about the question, so I will just say that. So if you have a group plan where you are offering Medicare eligible retirees benefits, the solution that the league has put in place is a grouped individual market transition solution. And obviously we're going to go into detail about that tomorrow. Also, you could have pre-65 retirees that are currently on your group plans. Those retirees could still be enrolled on the active employee platform that we've been describing today, but the retiree solution that we're going to describe tomorrow encompasses transitioning those pre-65 retirees to the individual market as well. So there's a couple of different ways that this could be handled. I'm not sure if I've answered the question. If you want to ask a follow-up question, please go ahead.
Okay, for small groups, are the carriers accepting the EDI or is it an Excel file upload?
I can take that. Yep. So the process for enrollment and eligibility between the carriers is actually done via what is commonly in the industry termed as an 834 file transfer. So the file is actually not necessarily going to be an Excel file that we're transferring between the carriers. It's a secure proprietary file format that is set up to upload directly into the carrier's eligibility and enrollment system.
And the thresholds for that are going to vary based on the carrier.
Barry, I know you had indicated that the platform is flexible and can accommodate other medical providers than those that have been pre-populated on the platform. The question is, can we bring in our own ancillary carriers or benefits?
Yes, those we could also build additional carriers onto the platform. You know, that's going to impact implementation timeframes, and so new carriers that are not already implemented, there could be charges or related to that. So that would be part of the discovery phase when we talk about what your needs are. We could kind of explain to you exactly how that would impact both cost and implementation timeframe. But absolutely, it's possible to accommodate ancillary carriers other than those listed in the presentation.
Okay, and another question is that since many cities are currently with CalPERS Health, can their plans be easily integrated into the platform?
So I will take this. So basically what we've done on the marketplace is we have looked at the plan designs that are a part of PERS, and we have worked with carriers to create plan designs which look very, very similar. The closest ones that we have are the HMO plans. Basically within PERS, there is an HMO plan design that is being provided by 5 different carriers, and then there are 3 different self-funded plans that are administered by Anthem within PERS, which are, you know, very rich PPOs. So we have plans which look very similar to these plans that are built onto the marketplace. So CalPERS is not going to have us put their self-funded plan onto the health benefits marketplace, though. So if that's the question, the answer is no, but we will have choices which look very, very similar to those choices that are available through PERS.
Okay. Barry, this is another question for you. We use CSAC as our broker. Is there a different system for CSAC? And that's the CSAC Health Insurance Broker.
So if CSAC is, you know, obviously there are several CSAC pools which are run by another broker. I'm assuming that you're not talking about those pools that are basically JPAs. If CSAC functions in the marketplace as a broker, we would be able to interact with them like any other broker to facilitate your enrollment on the health benefits marketplace. So, you know, we wouldn't discriminate against them in any way. You know, I'd like to hear a little bit more details about the question if I'm really hitting the mark here, but, you know, we can work with any broker effectively.
Okay. And we are almost through the questions. The one last question you've really kind of touched on, which is it needs to be an individual conversation, but the question is, can you please provide ballpark cost information based on approximately 900 full-time employees?
Again, I get offline conversation, because it's not, there are various different choices that a individual city would make in terms of the services. So we would need to really drill down and understand exactly what you would like to access through the health benefit marketplace to give you an accurate answer. Happy to have that conversation with anybody that wants to explore what the out-of-pocket costs for joining the health benefits marketplace would be. And then we could also talk about, your areas of cost savings as well to help offset those costs. So, but happy to have that conversation later today or in the near future.
Okay, we are nearing 11 o'clock for the 1-hour webinar. There have been a couple of questions regarding whether or not the presentation will be available. There will be a survey that comes out after the webinar, and attached to that will be a copy of the PDF slides for today's presentation. So with that, I will turn it back over to Barry and Patrick for any last words and comments.
Thanks so much, Norman. I appreciate that. So a couple of notes in terms of future events. Obviously today, tomorrow we have a health benefits marketplace that is a webinar focusing on the retiree platform, mentioned briefly today via Willis Towers Watson. So that is out there tomorrow. If you have questions or need to receive information about that, go ahead and visit us at cacities.org/HBM, and we can get you that information. We will have also some ACA compliance and wellness specific webinars. So keep an eye out for those if those topics interest you. We will be sending out more information coming in September here. And finally, in terms of the annual conference for League of California Cities, we will be in attendance and at booth number 629. And that conference, you can also gain access to additional information at the League's website. Finally, Norman mentioned you will be receiving a survey, so your feedback is incredibly valuable. As you saw on one of our slides with the ACA compliance, that we take all of that feedback very seriously and appreciate all of the questions and comments and things that come in through those. It helps us very much in terms of helping serve your needs through this solution. And finally, I will go ahead and leave Barry's and my contact information up here, as well as the League's informational page, www.cacities.org/HBM. Thank you all very much for your time today. We appreciate it and know it is incredibly valuable. And if you have questions, please feel free to contact us directly or through the League's website. Have a great afternoon.